I'm here with Dr. Homayoun Zadeh, a world-renowned periodontist and educator at the Vista Institute in Woodland Hills, California. Dr. Zadeh, we spoke 5 years ago when you were evaluating Navident. We had some difficulties and ultimately you decided not to adopt the technology and move forward with the purchase. About a year ago, we gave it another try and you quickly moved forward to purchase the combination of Navident and MicroMapper EVO. Can you tell us what changed?
Well, thank you for the question. I had initially been exposed to the Navident system through one of my friends and colleagues at Professor Hugo de Bruin at Ghent University in Belgium. I think it was 2015-16 time frame. The technology was very intriguing, and he was engaged in research. So as a research tool, it was really outstanding, and I could really see the application. But at the time, the level of the technology did not really reach to the level that I would use it in a routine practice. Every technology has the correct time frame when it's ready for adoption. You don't want to be the very early adopter. You want to adopt the technology at the point where it really benefits the clinical outcomes. And I could see the outcomes that currently are available, both in terms of implant planning, implant placement, as well as the complex implant reconstruction using the photogrammetry. The combination of the two was a game changer. And right away, I knew that this is something that is ready to be adopted into my routine clinical practice.
You're a periodontist, an educator, a perennial main podium speaker, and a phenomenal chairside clinician. A common comment from some of your specialist colleagues is that navigation slows them down, they don't need it, they place thousands of implants without it, and no one is complaining. How would you respond to that type of response?
I would say that it is true that every technology has a learning curve. As a clinician, we must always respect the learning curve of any new technology. Even for a very seasoned, experienced clinician, when they adopt new technology, there has to be that learning curve. And during that learning curve, for sure, the outcome will not be as great, and also it will take additional time. But as you go up on the learning curve, I think in many ways, it makes some of the preparation, it can shift it to the staff, so the actual chairside clinician's time can be shorter. Now, the key is that, yes, of course you can place an implant without navigation, you can use static guides, but the ability to make on-the-spot adjustment with dynamic navigation is really what makes a difference. What is the key that colleagues have to realize, that precision is very important in clinical practice. And this will improve the precision of the care. You will definitely be able to place the implant, but there's no question that the precision of the placement could make the difference between those few cases that could have some complications or not optimal to being optimum or much better than what you would have been able to do if you were to freehand that. So it is true that you can get by without it. You can use static kind of guides, but definitely the precision of the treatment is far better with the dynamic navigation, and the flexibility to make the on-the-spot changes sets it apart from the static guides.
How is the combination, we've talked a bit about how it's affected your staff and yourself and your ability to do these procedures. How is the combination of Navident navigation and MicroMapper photogrammetry made a significant difference for your patients?
I think from my staff standpoint, staff are always interested to learn something new, adopt something new into the practice. It empowers them to give them new tools, new technology, and new responsibilities. Sometimes when they get stuck in the routine, staff can actually get bored. So this has actually been empowering because much of that aspect is shifted to the staff in terms of taking a CBCT, doing some of the planning, and it's actually quite empowering for the staff.
How it's changed the patient, for instance? Is it the benefits for the patient, for the navigation and the photogrammetry?
Okay. Now, when both the navigation and photogrammetry were introduced, this was really a ideal combination. Yes, navigation by itself has a lot of application. Photogrammetry has application, but when you combine the two, it really makes it quite attractive from a clinical perspective to be able to adopt both. We were using photogrammetry before, but the technology is kind of clunky. You needed someone to hold the device in two hands and move around, but to be able to utilize the camera that's free-handed, and you don't have to manipulate the camera, you just work on the patient and trying to guide the patient position, that really made it much more comfortable as a clinician to be able to utilize the same device for two purposes.
You offer a wide variety of expert services here. Can you share with us some of the procedures you routinely use Navident for, the ones where you see the biggest benefit?
Of course, the routine application is implant placement, even single implants, basic implants. And I think when you explain to patient the technology that you're using, that is quite attractive to patient. And it sets you apart from other clinicians by putting you at the forefront of latest technology. So it gives you your patient confidence that the treatment that is being rendered for them is at the high level of technology that is available to them. Now, so that's everyday type of application for implants, whether they're single implants, multiple implants, full arch implants, immediate implants in socket. This is really fantastic because a lot of times you're really working blindly within the socket to be able to utilize the optimum position of the implant within the socket for immediate implant. This is quite a beneficial application. I'm also using it for socket shield to be able to very specifically remove portion of that socket shield to retain just the right amount of it. That's very useful. I'm using it for sinus augmentation, both for transcrestal as well as lateral window. The ability to utilize the piezosurgery to very specifically remove the lateral window wall, that's great. To use the piezosurgery for alveolectomy, for the resection of the bone for full arch cases, that's quite useful. I also recently did a root amputation, which is very interesting. We don't do that all the time, but to be able to remove very precisely the root with a piezo device, that made it very nice to be able to save someone's tooth. So, once you get the technology in your hand, you'll find other applications that were not part of the company's intended initial set of applications. So that's what's cool about it. You can just envision where you can fit that within your clinical practice.
Thank you for helping us figure what some of those are out, and we're only limited by your imagination. Please talk a little bit about the Vista Institute. You've got an impressive facility here. I understood it started as a single room up top, and now it's a much larger room. And while I'm here, I see that you're renovating another large room on the first floor of your building here. Talk a little bit about the Institute, the courses you offer, and how we're showcased here in those courses.
At the Vista Institute, we really offer personalized education, and we give flexibility to our participants to either participate in person, remotely, either live or asynchronously on demand. We have courses that range from regenerative therapies for soft tissue and bone augmentation, as well as implant placement, single implants, full arch implant courses. We are really incorporating the 3D digital workflow into our education. We're bringing, in addition to myself as being the primary educator at the Vista Institute, some of the world-class experts from around the world, the most respected educator clinicians who most of the colleagues don't have access to them on a routine basis. I'm fortunate to be good friends with many of them, and they're willing to come here. So what is unique about that is we have world-class speakers in a very intimate environment to put them into a small setting where you'll be able to interact with these world-class speakers on a one-on-one basis in a setting of lectures, workshops, also observe live surgeries, and the possibilities are to elevate the level of your practice by committing yourself for additional education.
Thank you so much.
Thank you.